So welcome back to the Start Living Again podcast. I'm here with Dr. G. Thanks for coming back.
My pleasure.
So I hope you have some time, and we're just going to talk about a few different things that have come up in the news, in the office, and just general health topics. I figure that's something that you're an expert on. I'd like to learn more, and I think that's just a little symbiotic relationship we've got there.
Sounds good, let's do it.
All right, so to start, there was an interesting article that I came across, and I showed it to you, and we had a long conversation about it, and I figured we could have that conversation again with a little bit more depth. So the article I came across was a doll that represents the next generation of office worker. So it was a mannequin that was made to look like what an office worker will look like in, I think it was 30 years. So,
which was pretty scary looking, actually. Yeah,
yes.
There's a very big hum, the head's forward.
20 years.
20 years. Well, I think it's a little bit exaggerated, hopefully. But I can tell you they're moving, that is the direction that people are walking into or moving into. And there's several factors. We sit way too much. People are not working a shorter week. It's not uncommon now to see people 45, 50, 60-hour weeks.
I can relate to that.
Yeah. All electronics, computers that people get lost in, which causes this
exact
anterior head lean, and they forget that they're in this horrible posture. And so it's a major problem because it's not being addressed. Schools do not address posture at all anymore.
So they still do scoliosis checks, but they don't do anything beyond that.
But they don't tell kids, hey, stand tall, how to stand, good posture. There's an Italian expression that says altezza e mezza la bellezza, which means tallness. But what it really means is good posture is half the beauty. So nothing is referenced about it. It's probably politically incorrect to even associate posture with looking better and stuff like that. But the bottom line is when you incorporate the amount of sitting we do, the prolonged week, the lack of exercise, the amount of cell phones, telephones, computers, we're looking at serious, not only posture problems, but neurological problems. As a result of this anterior head lean, you're going to be trapping nerves, particularly in the neck area. You're going to see us jump in cervical surgeries. You can mark my watch in 10 years, 5 to 10 years, the number of surgical surgeries to the cervical area is going to jump off the table.
Interesting. But the article also covers a bunch of other stuff like skin gets paler, eyes get bloodshot from staring at screens all day.
Well, not to interrupt you, but the body works on the electrical system of the body is a direct current. It's a one direct current.
Okay.
Everything you're surrounded by is alternate current. So this is stealing a certain amount of energy from the body. So as a result, the electrical potential of every cell starts to drop, changing the color, straining your eyes, causing all sorts of sleep disorders, energy, fatigue, and just a host of things that we're not even, besides posture, just the electromagnetic changes that are happening in our environment are detrimental to health.
So you actually have a machine right now in the office. You brought it in, and that's supposed to help with
that's
electrical.
That's a good jump. Yeah, we do. It's called a pulsed electromagnetic field therapy.
Okay. PEMF?
Yeah. Now this is relatively new here, but it's being used in mostly Germany for the last probably 3 or 4 decades.
Okay.
It's an offshoot of the work of Tesla, and what it does, it literally introduces electrical charge back into the body. So if you look at the body, like if you compare the human cell to a cell phone, cell phones don't work when they're not charged, nor does the cell of the body.
Yeah.
The difference is...
Like my laptop at 12% right
now. So the difference is cell phones, it pretty much works at 100% until it loses that last bit of charge and shuts off.
Right.
The cells in the body will, as the charge drops, the function drops.
Okay.
Once you start getting below a certain level, cells become inflamed, they become painful, and if you can reestablish that cell, pain diminishes rather quickly in some really serious cases. The difference is, or I shouldn't say this, the other similarity is that like an old cell phone doesn't hold on to a charge very long.
Right.
The therapy, if you do, besides get past the relief, and you want to really get your back where your body's like a new cell phone, holds a charge. It takes a certain degree of commitment and consistency.
So you have the recovery phase of treatment, and then you have kind of a maintenance program.
Yeah, or a restoration of maximum electrical input that the body can handle and maintain at that point in time. Again, but our first phase is always, let's get somebody out of pain using this pulse therapy, which has just been wonderful.
Well, with any of the therapies, the goal here is to have them leave with less pain than they came in, ideally with no pain, right?
Yeah, I mean, I know I can share one case, and this was really what motivated to get the system. We had a patient who, female in her 50s, severe low back pain, a slender lady, probably come January, maybe 95 pounds, was in severe pain, had surgery in March, was worse, came to us in September on severe medications as far as morphine. And you never see morphine used unless, the only time you see morphine is you know somebody who's dying of cancer.
Right, that's
but
the only time
she was
I've
on
heard about
morphine, could not walk, she was carried and helped in. And we worked with her for about 6 weeks, and I can tell you, with not much help. I knew about the pulse electromagnetic field therapy. I found someone that had a system.
Okay.
I said, please, let's just... So we did an introductory 3-visit treatment with her on a Thursday, Friday, Saturday. She walked in Monday, walked in on her own. She went to her son's football game, and she was probably 70 to 80% better.
So she went in from being
So by the way,
carried
when she came in September-ish, she was 65 pounds. Yeah.
65 pounds?
65 pounds, yeah.
Wow.
Could not eat. I'm telling you, she was, and 2 doctors wanted to do massive surgery at 65 pounds. I am convinced if it wasn't for the pulse electromagnetic field therapy, turning her case around, somebody would have killed her. You know, I think her body was not capable of handling a massive surgery like they want to.
But she avoided surgery, or she had surgery?
No. Never had surgery. I actually, fortunately, found a surgeon in Manhattan. I said, please just give a second year. I need an opinion. They wanted to do surgery, and I told him, and he said, I'll do it for you. And she went to the city. They brought her to the city.
Right.
And he said, stay away. No surgery at all.
Yeah, so you...
Thank God.
So she, on, what was it, Friday came in? Well,
I think she came in, but no, if we're not helping, I think it was either Thursday, Friday, Saturday, or Friday, Saturday, Monday, but by Monday, she was 70, 80% better.
That's incredible.
Yeah, different color. I go, she was here, she was gone. You can just see when someone's in so much pain,
right.
their
delirious.
mind, the mind was somewhere. So it was really a blessing.
But what do those treatment sessions look like? Because, I'm imagining you get plugged in like a, straps on your wrists or something like that,
no straps at all. You lie. Well, okay, so there's different. You can lie on this mattress that has this electromagnetic field coming out. You can sit in a chair. You can have a pad. So again, depending on the person, if we feel like somebody's exhausted, we may do a full body with a little extra attention on like adrenal gland to help the body get going a little bit. But you just lie there and you'll have a little bit of a jump this electromagnetic field creates.
And those are the contractions in your muscles?
Those are partly it's stimulating some of the nerve endings, and you'll get that reaction. So we want that reaction, by the way. So
it's not uncomfortable.
No, not at all. So a patient should feel that sensation, whatever you want to call it. It's kind of a unique feeling. It's hard to describe. Most people enjoy it, so it should be a mild, moderate sensation.
Okay.
And they sit there and lie there. That's it.
Yeah, so you don't do any work as the patient.
Just have to lie there and relax.
Yeah, that's not a bad
No undressing. You got to get metal off your body. You don't want any metal. If you have a pacemaker or any other implants that are electrical, not a knee's fine or a hip replacement's fine, but if it's electrical, you can't do it. It's contraindicated.
Right. It sounds dangerous to have a pacemaker and electrical currents.
Yeah, you don't want to shut that off.
Yeah,
so that would not be good. But other than that, if you have hearing aid, take them out.
Okay.
That type of thing.
But if you have like an implanted hearing aid, it would maybe not be ideal for them?
No, you wouldn't do it.
Oh, you wouldn't do that?
Yeah, if it's an electrical device, you can't use it. Yeah.
Interesting. But this system isn't for everyone, right? So I have a little bit of back pain. We're treating it with some physical therapy, but I don't need that kind of therapy. It's more of
if you're in pain, I wish I had the book here, but Dr. Tennant, he wrote a book called Voltage is Healing, or Healing is Voltage, about a 500-page book on the different effects of this voltage into the body.
Right.
If you're in pain, he says that you would almost have to guarantee that there are cells in that region that are not at a normal level of voltage. So every cell should have about 20 to 25 millivolts. And when you're in pain, those drop below. So a young person like you probably within a couple of visits would see a significant change.
Right, but like it wouldn't be necessary. It might be beneficial, but you wouldn't recommend it for everybody to do it, right? Other than like obviously everybody should be taking a multivitamin, everybody should be exercising more, but like it's not necessary medically to get everybody on this.
Would it be optimum? Sure, it would be great if everybody could do it because it wouldn't hurt. It would really. I mean, are you in front of a computer
all the time?
Are you
8 hours a day?
Are you under a lot of alternate current that's sucking this electrical force? Sure you are. So if you are, I mean, what this does, they call it a cellular exercise. Okay. So it does to your cells what exercise would do. I mean, I'm talking aerobic exercise. So if you were running 3 hours a day or doing this swimming out in the sunshine, and you're relatively healthy, that's what you would need it. But that's what the table kind of replaces. Okay. So elderly people, they can't do that. They just cannot get enough exercise to get their systems charged again. So
they're the ideal patient cases. Like they'll benefit the most is because their charge state, correct me if I'm wrong, is the lowest as compared to somebody younger who might have not had that diminishment.
Right.
Okay.
Right. So, and the interesting thing about this system, chronic conditions, people tend to respond faster than a person that just had a recent injury.
Interesting.
Yeah. So it's interesting. Like, you would think it was just the opposite. Yeah, but chronic conditions respond, symptom-wise, respond pretty fast.
Okay.
In fact, what we do is we actually offer, because it's so new, we actually offer a 3-visit trial for $99. Of which we give $25 to the Center for Food Action.
Okay, and we're also collecting food downstairs.
And we're collecting food downstairs, yeah. A lot of, I mean, listen, it's surprising that we're surrounded by people, neighbors that either due to unemployment, mental challenging sicknesses, are all of a sudden having a tough time making ends meet, having enough food and basic necessities.
So any of our current patients should bring in a can.
Yeah, it'd be really nice. We appreciate that. And again, if you want to, if you actually do, if you know somebody with chronic pain and they want to try the pulse electromagnetic field therapy, it's a $99 fee, and then we take $25 of that and donate directly
straight to the CFA.
Yeah.
Okay.
So, awesome. Which is good.
Yeah, to give back to the community and
they feel better.
Yeah, exactly.
Right.
Can't lose with that, right?
Nope.
All right, so we've got a few questions that I've seen on Reddit. So a lot of people on Reddit will go in, ask a question, and you get a bunch of internet doctors that'll respond to these questions and tell their personal opinion, basically, of what they think they should be doing. But obviously, having internet doctors is not as good as having a real chiropractic doctor in front of me. So I'm going to bring up the question, and then we're going to talk about it. So the first one that I had that I didn't think was getting sufficient good responses was, will decompression or traction resolve cervical subluxations?
Yes, absolutely. So
let's break it down though first.
Okay,
so we got decompression, that's something we do here, or traction, resolve cervical subluxations. So what are cervical subluxations, and then like obviously how will decompression help that?
So subluxation is a chiropractic term that means less than a dislocation, but it's some type of misalignment, a fixation where a vertebra gets stuck together.
We covered that in the last episode.
Yeah, but that has some type of interference with a nerve.
Okay.
So you can just have a fixation, okay, or you can have a subluxation that is causing some neurological symptom, whether it's pain, radiation, tingling. But decompression, there's no way, decompression typically is designed to put a disc back in place. Okay. Follow? However, when you take the cervical or low back and you gently distract that and separate it, these misalignments will release on their own. Okay. So it will help with subluxation.
Okay.
Yeah.
Because a lot of people are saying that it might, maybe, what are you talking about, traction? So, all right, so decompression or traction will resolve or help cervical subluxation.
Yeah, and so if you find a chiropractor, and I'm not here, but I would assume that if a chiropractor is only using what they call diversified, where they're literally manually manipulating, which I do here,
right.
But that's their primary source of treatment. I would believe in his world, he's probably going to say no, unless you manipulate that area or mobilize it, it's not going to release. So in my experience, I mean, I'm doing this 44 years. I've literally treated over 300,000, or I've given 300,000 plus adjustments and treatments. So I can tell you that the decompression will deal with subluxations.
All right.
Without a doubt.
That's good to hear. All right. So another one is, there's this patient who's been seeing a chiropractor for a full year, and they've seen no progress. And a few of the details are they've received adjustments to the upper back, and they have pain in the lower back, which is off and on. And then they're asking, a special component of this is that should they see a different chiropractor, or is it that they're just not doing enough visits and they need more time with this chiropractor? Okay,
so there's a lot of possibilities there. One, is he being consistent with care? If he's being consistent with care and he's now gone, in this office here, if you've gone 3-4 visits, you're not seeing a change is required. That may be a change in procedure. That may be a change of incorporating possibly of getting a medical doctor involved. Maybe there's so much inflammation that it doesn't want to release. But you need to change the formula. You just cannot do the same procedure and assume, okay, it's going to work. So the body is remarkable as far as its ability to heal, provided you turn the right switch on.
Right.
So you might be missing the switch. There may be something else there. You may need to incorporate an outside. In this case, for instance, every so often we'll find a disc that's so inflamed, decompression just doesn't work. So what we'll do in those cases is, we'll possibly look at incorporating epidurals. So we'll send them out to see a pain management specialist. And if they can shrink that disc enough and give us a window now where decompression will actually pull that disc back into its center because the swelling has calmed down. Okay. And once it's in the center, once the medication wears off, it's already in the right place.
Right, okay. Because they did mention in their question that they don't want to go to a pain management doctor because they are afraid to get, quote, doped up with opiates and get into that mess.
Well,
so it's not just opiates at a pain management
that's
center.
just it. So if you're going to get on, because there are pain management specialists that will get you on a oxycodone or something like that, and now you're on a situation where you're just taking a painkiller to hide the pain. Epidural I like, or especially for these challenging cases, it's very specific. You're going to go right in. You don't feel it. You'll feel if you're awake, you'd feel the needle, but you're not like on this drug that alters or hides the pain. It has a very specific purpose of reducing the inflammation, but it's really important that you incorporate the therapy while you're under that influence. So we've had people in the past that have had epidural, and they say, oh, it didn't work. And well, the decompression didn't work, and the epidural didn't work, so that's why I got surgery. Yet, if you would have put those two together, it probably would have worked.
Right, it's like sitting on a couch eating crappy food, and then I have a headache, so let me just take an aspirin. Why is it not helping?
Yeah.
You got to move, you got to drink water, you got to stop eating the crappy food, and maybe your headaches will go away.
So, and one night, if you had a 200-pound boulder you had to move, and the guy says, we've determined it's going to take 3 people to move it. Well, if one person comes in the morning and leaves, and one guy in the afternoon leaves, it doesn't move. There's some coordination involved.
Some synergy between
So with the epidurals and the decompression, it'll turn around. You've added a new factor into this formula of getting something better.
Okay.
And that's important. Patients need to know that. If the doctor is not changing, you don't have to change doctors, but if he's not changing the formula, to me, it's time to consider either asking him or possibly moving on. You might need to see another chiropractor or another profession.
Okay. So the recommendation for this patient, although you're not telling him they should do this, but they should consider potentially that the chiropractor needs to mix up the strategy, and if they've already done that, to be potentially seeing a different chiropractor and to maybe take the recommendation of the pain management, because they're not just going to give them opiates. They might also be offering.
Further, does he have an MRI? Is that what it is? So you need to look at the other. You got to look at the whole package. Does he have an MRI? Is it a disc herniation? How does he present? And so, I mean, there's so much. But the bottom line is, some change is necessary. Something has to change, whether the procedure, the doctor. But again,
the same thing for a year is clearly not effective, so something has to change.
Some change, yeah, absolutely. It could be his schedule. Maybe he's coming in once every 2 weeks. Maybe that might be it. I don't know. So something. Maybe his schedule has to change. Maybe the doctor has to add a more non-force technique. Maybe he has to get more force. Maybe he needs decompression. Maybe he needs later. Maybe, who knows? But something has to change to make this work.
Right, and that's something that I've noticed with the patients here is we do mix things up, right? We're not seeing, hey, I come in, get my back cracked, and then I head out, and then I come back twice a week, every week for 2, 3, 4 months, and I don't see any change. We always see changes.
You got to see change. Okay. You got to be product oriented or outcome oriented. The patient's got to be. That's the first thing. And I tell them, hey, the first thing is we need to make you feel better. But that's the first layer of this onion. We now need to correct the structure. We need to stabilize the structure. We got to strengthen it, and then we got to look at what modifications in your lifestyle. Going back to the very first question, how are you sitting at work? What's your chair look? Should you have a stand-up desk? Should you have a bar stool more than a chair? How many breaks do you have? Is your computer in the right position? And are you doing home exercises? Are you going to the gym? All that needs to be addressed.
All right. So those are some of the things that we're going to address in the videos that we're going to be putting out. So one of the things you mentioned was stool versus having a super nice ergonomic chair. We've got some alternatives. The Nada chair. We've got the stool, like other things that are alternatives that you can incorporate into your office. You don't have to go through HR necessarily, right? You could be doing stuff on your own because your health is more important than your job, really.
People can be in a lot of pain, and I've seen it where they go, well, my boss won't go for the stand-up desk. They're like $350. Yeah, you don't want to pay for it, but if it comes down to having a serious back problem, sometimes you just got to get the desk.
Right. Out of pocket, right?
Yeah.
Sometimes it's really too important.
You need to put certain priorities. We had a funny, terrible story years ago. We had a patient whose wife was there, and she was laboring. She couldn't breathe. I mean, it was horrible to even watch her.
She wasn't the patient, though.
No, she was. I said, you need to get her some oxygen. He goes, oh yeah. And again, a month later, they come back, and I said, how's your wife? He goes, did you get the oxygen? He said, no. And he said, the insurance wouldn't cover it. And so here's this guy looking at his wife, laboring, breathing, gasping for every breath, and insurance didn't cover it. He wouldn't go out. And so, we need to start realizing that sometimes you got to take the responsibility of doing what you need, even if insurance doesn't cover it. So sometimes the stand-up, by the way, stand-up desk is typically better, but two things.
Better than a stool
or sitting mostly, but the body needs good posture, but it also needs motion. Right. So you can be in a perfect posture chair. You need to, sometimes there are certain exercises you can be doing while you're seated that are important. The body, joints need motion. It could be a simple, what they call posting. Mm-hmm. Sometimes you just get up and take a little walk. Unfortunately, I know in certain European countries, it's the employee's right. They call an ergonomic specialist, and they're right. They come in, they do a whole assessment. They say, hey, this person needs a stand-up desk. The computer needs to be here. This stuff.
Sounds very European.
Yeah, we're not there yet.
Yeah, but we're going to try to help. So I think that what we're going to try to do is we're going to create content to help people on their own without needing to spend too much money, and we're going to give them recommendations on the best option and maybe a cheaper option of how they can incorporate healthier just habits in the office, specifically because I think that affects a lot of people, but then at home, right? Mm-hmm. So if anybody wants to comment below this video and add something that they would think is more important to cover now, so if they are an office worker and they have certain constraints, comment below what you would like us to create a video for so that we can help you as soon as possible, and then we'll try to cover as many topics as possible in the coming days, weeks, and months. All right?
Sounds great.
All right, thanks for this conversation.
Oh, my pleasure.
And we'll do this again sometime soon.
Great.
Okay.